I'm Dr. Norman Miller. Facility is in Salem, New Hampshire. My specialty is vascular surgery. For the last 6-8 months now, we've switched our practice into exclusively venous work. And background education is I did a residency in general surgery at McGill University in Montreal, and then I did a 2-year fellowship in vascular surgery in Englewood, New Jersey. Member of the ACP, probably for over 15 years by now. Most frequently asked is, can we really get rid of that? Many patients come to us and they just been told many times, just wear stockings and don't do anything for it. Or they expect major procedures to eliminate those veins. And they're always amazed that you can eliminate those big lumpy veins with simple procedures done under local anesthesia in the office with minimal downtime. And in fact, at our center, we will every few weeks, every 6 weeks or so, we do what's called a 3-vein screening, where the patients can sign up, be evaluated, and we give them an idea of what can be done. And it is the best opportunity for a patient who thinks they need something major, the best opportunity to find out that they have some minimally invasive methods of eliminating the problem. And it's a good way to educate the patient as to what can be done in this day and age for varicose veins. Do not call it a free consultation. Technically speaking, if you participate in if you're a provider for different insurance companies, consultation cannot be given free. At Medicare level, it cannot be given free. So a screening is that the patient comes in, we will look at the patient, I will still have a short discussion with them as to what's happening, what they have, and what can be done. So it's called differently. It's not a full consultation with the patient where you would normally spend half an hour with the patient going over the different options, but at least we can inform them as to what their problem is, and from a first evaluation, give them an idea of what could be done to eliminate their problem. Well, they'll spend with us 15-20 minutes. We have 2 nurses in the office when we see them. I will personally spend 10 minutes with the patients, or on the average, some patients very easy, simple, it's 5, others it's 12-15 minutes, but I'll spend a few minutes with the patients examining the legs and trying to give, without ultrasound, but trying to give the patient an idea of what route we would take to take care of their problems. I tell you, surprisingly, and maybe because I have this vascular surgery background, although we're not talking major surgery for this anymore, but over 60, probably over 70% of our patients come in with large varicose veins, those lumpy, ropey veins. Over 2/3 of our patients, this is what they have. And the majority of those people will need an endovenous treatment, whether it is radio frequency or endovenous laser. This would be the treatment for many of them. Because any recurrence, any veins coming back, can be managed very well through using ultrasound to guide us, injections of different products to eliminate the veins. Twice a day I have patients I can't believe. In fact, last week I had a patient who said, "Doctor, you must sleep well at night." I said, "Why?" Well, she said, "You're doing so much good around you, you must feel great." I said, "Thank you very much, that's nice to hear."
When did this patient call you, last week?
I was seeing her in the office because she was about a month after her last procedure and she couldn't believe all those veins were gone, and said, "It feels so great." And I had, the same day, I had another patient who came around, and I was coming for a second procedure because that was a stage, she had so many, and that was the last one to eliminate all her veins. And the first thing she said when she got there, said, "Oh, I was so nervous this morning, I was afraid I would have an accident coming in, I couldn't make it to this procedure." I get letters, patients who tell me it's hard to believe, but I enjoyed being there, having a procedure done. I get that very often.
Thank you, Doctor.